Welcome back to the Best of Raleigh. You know, healthcare today, it's evolving. And today, it's about more than just treating illnesses. It's about optimizing well-being. And that can mean a lot of things. That's exactly what Vega Vitality is bringing to the Triangle. And at the forefront of this expansion is Dr. Andrew Donohoe. Andrew isn't just a highly respected physician, he's also passionate about helping people feel their absolute best. As the medical director of Vega Vitality in Fenton and Vega Wellness, he's combining cutting-edge treatments with patient-centered approach to health, which is huge. But what sets Vega apart, and why was the Triangle the perfect place to start this new chapter? Today, we're going to dive into all of that and more. So Andrew, thank you so much for coming on the Best of Raleigh. I'm so excited for this conversation.
Thank you, Gretchen. It's great to be here.
Welcome to the Best of Raleigh with your host and real estate expert, Gretchen Coley, owner of the Coley Group. This show is all about the people and places that make the Raleigh area so special. Here's your host, Gretchen Coley.
Yeah, so I had an opportunity to visit last week, and I'll tell you, I really loved the space, the atmosphere. You guys are in Fenton, right beside our house.
Yep,
which everybody knows on the green side. And the space is just really beautiful. So Andrew, let's talk a little bit about your background, because there were so many things that I was impressed with at your facility, especially the fact that there's an MD in-house, right?
Yeah.
So tell me your background.
Sure. So I went to Duke undergrad, and I'm from Philly initially. I missed home, so I went back to Drexel for medical school, and I'm board certified in internal medicine. I did my residency at UNC, so I've gone to both sides of blue down here. And I stayed there as an internist, hospitalist, for the past 10 years or so. Primarily, my responsibilities there have been admitting patients through the emergency department, so getting a lot of experience seeing patients who are pretty ill, coming in the door, usually pretty miserable, having an awful day, I would say, in that context. And getting to know patients in that setting has been incredible for the past 10 years. But I think part of what Vega Vitality has tried to do is use medicine to help patients really improve their quality of life. And it's not just about taking care of patients when they're sick and need to get back home, but once they're home, how do they enjoy their quality of life? How do they get better sleep? How do they optimize their energy? How do they feel confident? Those sorts of things.
You know, I'm into all of that. I love wellness, and I also love beauty. And I think there is a combination of feeling good on the inside and looking good on the outside, like feeling looking the age on the outside that you feel on the inside, right? And that's one of the things that I really loved about visiting Vega Vitality, is that you're helping with the inside and what's going on from a wellness aspect, but you're also helping with some little crow's feet and some skin and laser treatments. And, how do you properly optimize all of that, I think is really something that we should be looking at, because just like you said, you can treat the problem after it's happened, right? Yeah. Or you can take a proactive approach and maintain whatever you believe is your best, correct?
Yeah, unfortunately, I think part of the stigma about med spas over the past several years, many years really, has been the concern that it is just very superficial and very artificial, very fake in some ways. But I think, over the past couple of years, there's been more acceptance that there's such a mind-body connection, and that trying to be in the best position that you can be at any age to feel as confident, to have as much energy, to feel attractive, to feel like you look as good as you feel, or vice versa, that you feel as good as you look. I think it's not necessarily fake or artificial to feel energized, to feel happy with yourself. And there's a lot of ways that medicine can really support patients in that way, either internal health and energy or externally, like you said, with some anti-aging techniques. But in either case, I think this is really the interplay between those two things that we try to focus on.
I love that, because I do think that there's not enough of that, right? And I shared a little bit with you. You all know probably from some of our past episodes, I was a world champion fitness competitor at 36 years old. And I went on that journey for years. And it was one of the points in my life where I felt the best, right? I was working out every day. I was eating well. I was taking care of myself. And I felt and I looked really, really great. That kind of discipline discipline is required for that, but that's not what you need to do to look and feel great all the time. What you do need is healthy guidance from a nutrition perspective, from a supplement perspective, and I definitely want to get to the outside, but and we'll get there for all of you who are watching. I promise we're going to talk about all the things that you want. But when I built a fitness program, I knew that women wanted to buy a fitness plan and a nutrition plan, but what they needed was habits and routine creation, right?
Yeah.
So I know women come in, or everyone comes in and wants to get something for, their skin, their wrinkles, whatever. But starting from the inside and working your way out is really important. So talk a little bit about the services that you all offer from a wellness perspective.
Yeah, I'll say, I guess just to start and sort of echo your point, is that of all the things that we can do aesthetically to make patients' skin glow and to help them look as young as they feel.
We like glow.
That being healthy, in the same way that you can look at somebody and tell when they have a cold or they have a migraine or something, their eyes get glassy, they just look run down, you can see that they're not well. But the opposite is absolutely true, which is that it's really difficult to replicate the glow of being healthy unless you're actually healthy. And there's a lot of things that we need to focus on about that, which is, again, why I say this is a very sort of natural, comprehensive approach. But within that, and at Vega Vitality specifically, because my background is internal medicine, we do take this kind of all as an entire package, sort of a complete approach to what's going on with you. What is your medical history? What medicines are you on? What is your family history? And what are you struggling with? And some of that may be part of how your medical history is influencing the way you feel. We obviously can't turn everybody into a perfectly healthy individual if you come in with certain medical, with certain diagnoses, but we can optimize, how you're feeling and how you're doing. Taking care of all of these things really has an exponential effect in terms of the end result. We do offer weight loss coaching, but I think that right now in the industry, there's a very wide spectrum of what that looks like. Because on one hand, you can just order a lot of these medications offline and you're left on an island to sort of figure out how to approach that safely and effectively. And then on the other end of the spectrum is something more like our program, which is very comprehensive, having access to nutrition counseling, having a well-integrated wellness app where we can track body metrics and communicate well with patients and follow up regularly. Coming in regularly to talk with us and let us know how you're doing. The end result of your weight loss journey, whether you're trying to lose 15 pounds or 100 pounds, is really specific to you. It's very patient specific because everybody's physical capabilities for exercise is different. What their dietary habits and their dietary restrictions may be is quite different. And so just plastering a universal approach to that is not going to end in success for a lot of patients.
I agree with that. And I just want to make a couple of points on that because I have a lot of girlfriends. We all deal with the same issues. And, I've always felt like with my nutrition background, I have people call me every day and they're like, where can I go get a nutrition plan? Where can I go? Who can I have to help me, counsel me on that? And there's not a lot of places that offer that because it's not a high profit model, right? Yeah. Let's just be honest. It's not, but it's a necessary model for any long-term change. And from my point of view, it's very easy to take a medication like a semaglutide or do something that's going to help you lose weight, and it will. And it's a great medication for certain people. It's not for everyone, and it really needs to be monitored. But if you want that change to last, you have to pull in some components of hydration, nutrition, level of fitness in some way, shape, or form, whether it's just walking. Like there have to be some add-ons to that. And having someone to help you through that, I think, makes any kind of short-term process you want to do more impactful.
Yeah, absolutely. We battle against a lot of things in this industry, and in this industry, I mean healthcare in general, but misinformation out there is one of the main things. And so, just coming in to consult and talk through what your goals are and how you hope to achieve those, we can really at least kind of start down a path to achieve success. But you're right, the risks and the sustainability, all of that depends, I think, on a very personalized model. It's one of the things about not just misinformation online, but what you read, even if it's in a well-trusted format or article, may not apply to you.
Yeah.
What worked for somebody else may not apply to you or be successful for you, and there may be very legitimate reasons for that. We just have to help you find it.
I think that's spot on. I think a blanket diagnosis or a blanket like this works is never a blanket, and I've seen that over and over and over. And when it comes to Vega Vitality, you've really built a strong reputation, and now you're leaning into this expansion in the Triangle. What made Raleigh, specifically Cary and Fenton, a place that was targeted?
Mostly because this is home for us, and the Boston location has been established for about 10 years. And like you said, they've done an excellent job showing that this model delivers good results for patients and that patients really respond well to being taken care of in this way. I've lived down here since residency in the Triangle. My family and I love it down here. We have no plans to go anywhere else.
We'll keep you.
And so, this is home. I think in the same way that, working at a local hospital and taking care of the local community has so much fulfilling about it. I think, starting a small business and opening up shop in a town where you live is equally fulfilling. It's much more difficult owning a small business, but
hey, owning a small business, it ain't for the faint of heart, man.
Yeah.
Like this is a whole different ballgame, isn't it? And I want to talk a little bit to help everyone understand the start of Vega Vitality. You said it's been in Boston for 10 years. Talk me through a little bit of that.
Yeah. So very homegrown, I would say obviously a very personal story for us, but my best friend and I have known each other since third grade. And grade school and high school together. We parted ways geographically in college. He went to Boston College, and I went down here to Duke. And that's where we stayed. He met his wife, Ashley, and she was a CICU nurse at the time. She started Vega Vitality about 10 years ago. And my friend Jeff and I have kept close. I've known Ashley the whole time of their relationship. And through the start of Vega Vitality, so we've been very involved in that process and its growth over time. She started just with her as a single practitioner in a single room, and it's grown, to this over time. 2023, the stars started to align in a place where our children were old enough to consider a new adventure, and so we started looking for commercial real estate and really wanted to do something in the Triangle in a place that was going to showcase the business. I think Fenton does a lot in that regard because there are a lot of these places that are a little bit off the beaten path, and I never wanted it to seem as though this is something that you had to hide. And I think sometimes there's this concept that if you go to a med spa, you sort of have to go in a dark alley and go in and leave and make sure nobody saw. And I understand the privacy part of that, but I also think that being healthy and taking care of yourself is something that we should really be proud of. And
I agree.
Yeah.
I agree, and I love the organicness of that relationship, and you guys starting this partnership to open the Cary location. I mean, y'all have had such a great trajectory together, but you came from internal medicine. And from ER, why are you so passionate and so wanting to change your career path, basically? Even though you're not changing your MD status, but you are changing your career path from working in a hospital system to basically being a partner in your own business. And you've got young children, right?
Yeah,
How old are your kids right now?
6 and 9.
So you're in the thick of it.
Yep. And they love it. Our 9-year-old sits at the front desk and he's ready. He has his own little Vega jacket.
Yeah.
They're excited. I think the difference in career, the difference of how I approach it at least is that if you come to the hospital because you've got pneumonia or you're having a heart attack or whatever medical catastrophe has happened to you, there's something that ends up being very objective about what the x-ray shows, what the labs show, how we take care of you, how we get you better. And that's all so important at that time. But it doesn't always allow for how much medicine can accomplish for patients to improve their quality of life. And I think one of the downsides of how the medical industry currently is structured is that if you go to your primary care physician's office and you have to talk about how your blood pressure is doing and how your blood sugars are doing, what your weight is doing, your time is so constrained to just talk about those things that really for how you feel. And this is the challenge. We spend a lot of time trying to convince patients that having a high blood pressure is a health risk to them because they don't feel it. What they do feel is that they don't sleep well. They don't recover as well as they used to. They don't feel as attractive as they want to feel when they go out on date night with their significant other. There's things that still impact them on a daily basis, and medicine does have the ability to affect those things and improve their lives. It's just that in the current context of primary care doctor appointments and hospitalizations, it's not the venue that we typically talk about those things. We don't get an opportunity to do that for patients. So it's there. We just need the right outlet for it.
Yeah. So today's episode is brought to you by the Coley Group, the #1 Compass team in the Triangle. And if you're thinking about buying or selling a home in the Raleigh area, or you just want to get a feel for its neighborhoods, we would love to help. So whether you're moving in 6 days or 6 months, we're here to help you find your perfect spot in Raleigh. You can call, text, or email, or you can take a moment and fill out our 5-minute neighborhood match survey, which will save you 5 hours. It will match you with 3 perfect neighborhoods for your lifestyle and your lifestyle only, and I think you'll enjoy it. So take a moment and take that neighborhood match survey. I was very intrigued to learn about all of the treatments that you all have. And so now I want to go to a little bit of the fun stuff because, I don't think that everybody thinks that weight loss and nutrition are sexy things, but they are. They're totally awesome. But, a big piece of the med spa is the outside, right? So you're helping with skincare, anti-aging, maintenance, laser therapies and such. What are some of the most popular and innovative treatments that you are offering right now?
So probably the most innovative treatment we have, I say this acknowledging that a lot of these things have been around for a long time, including hormone therapy and a lot of the aesthetic treatments that we do. The difference over time is that either things get approved for new treatments or just through practice and expanded use, we learn that something can be used more effectively to treat certain problems that we didn't know 10 years ago. So I think that's important to know, at least from a safety perspective, that not all these things are just
new.
on the market. We've had a lot of experience. Sculptra is a great example of that. Sculptra's been around for a long time. We know a lot more about how to use it now to help build collagen and improve skin laxity.
And that's something you guys are really in on. I talked with my therapist a lot about that because I've never done Sculptra.
Yeah. So the realm of fillers and then biostimulants, which are things like Radiesse and Sculptra, those biostimulants are in a category that cause your skin to produce extra collagen and elastin and improve the overall volume of skin and help improve laxity. Again, those have been around for a while. They're gaining a little bit more momentum now, not only because of how we understand how to use them, but also because socially there's been a push against filler. Now on social media, you'll see a lot more concerns about what happens with filler after you've been using it for 20 years, or how does it migrate. And I would say this about that, because that is a large conversation, and there's a lot of complexity to that. Filler is very safe and does achieve exactly what we want it to achieve. I would say that that conversation often doesn't acknowledge the injector. You really want to go somewhere with an experienced injector that you have a good relationship with and you trust the clinic. We could talk a little bit more about what that means as well. But it's a little bit like going to, a barbershop or a stylist, a salon, and getting your hair cut, getting a bad haircut, and then blaming the scissors. It doesn't really have that much to do with the tool as much as it does the person cutting your hair. Filler and Sculptra and Radiesse are similar in that regard. Really much of what we do in the aesthetic industry, honestly, because any device, any laser, any microneedling device is as good as the hand of the person that's using it.
Other than Sculptra, what else?
One of the more innovative things that we have now is called NeoGen. And we have some patients coming in from time to time asking about CO2 lasers.
That's on my radar.
That's in the category of ablative laser. It does sort of literally resurfaces the skin through a fair amount of damage. The challenge with that is it's a lot of damage, and it's very intentional, calculated damage to get your skin to regrow and resurface. There's some downtime associated with that. It can be pretty uncomfortable, and it's going to require about 5 to 7 days of downtime. NeoGen does a lot of the same things, but it's actually not in the category of laser. It fires ultra-heated nitrogen plasma into the skin, the deeper layer of the skin, and actually preserves the skin status. We also the skin surface as your skin heals, and so there's not quite as much downtime. The other really nice thing about the NeoGen is that we can scale the energy level on the device from really low, and you can almost do like a weekend glow up with it at the lower energy settings, up to something quite high, which becomes a little bit more like a resurfacing similar to
Can you do that
CO2.
under the eyes?
Yes, great question. So under eye, around the eyes is one of the most common questions that we get.
That's my hot spot right now. Just so you know,
Yeah.
I'm thinking about CO2
Yep.
under my eyes because I can't. There's no amount of Botox I can inject under my eyes to get rid of the wrinkles.
Yeah. So
Not that those are bad. They're just not for me.
yeah, when patients come in asking about around the eye problems, it really is not a single issue necessarily. Sometimes people have some hollowing out under the eyes where they need a little bit more volume in that area. Sometimes people have eye bags, which is a very
different-
separate issue. And I think one of the things that we've really our goal at Vega Vitality has been to have such a comprehensive list of services that if you come in to consult on a problem, whatever's bothering you, we have pretty good options, really kind of the best options out there at the moment to help address those things. If you go to a clinic that really only offers a couple different services, you won't be surprised to hear that those services are going to fix all of your problems, but that may not necessarily be accurate. There's a lot on the market right now for a variety of different skin concerns. It's a lot to keep track
Yeah.
of. It's a lot of information to sort
Yeah.
through. Coming in for a consult is really kind of the first step in just talking through it. The eye question, though, is as far as the NeoGen is concerned, it's one of the few devices that can actually go right up to the eye, the edge of the eyelid. We can do that on upper and lower.
Why didn't you recommend that for me
That's
last
tougher.
week?
That's tougher.
Okay,
with
I gotta
lasers.
come back.
Yep. That's tougher with lasers, but
Yeah.
we avoid the eyelashes, of course, and we avoid the eyebrows. But other than that, we can do the whole area.
Well, one of the things I enjoyed about our conversation, our visit, was, well, number one, I get overwhelmed very easily. I went on the website and there was like 55 things to choose from, and I was like, I just can't choose what I want to do. I'd rather just come in. And you said to me, you did exactly what we want our patients to do. We want you to come in and tell us your issues and let us help with the strategy versus you coming in going, I want to do a CO2 laser, not asking the right questions, getting a treatment that might not be the best treatment for you because you saw it on Instagram and it's fixing everybody else's stuff and you see the eye tighten right there while they're doing the laser. And I was like, oh my gosh, that's like a breath of fresh air. I don't have to decide for myself and I can get this holistic approach, which I loved.
Yeah.
So
Yeah,
thank you
thank
for
you.
that.
Yeah.
Now, who are the clients you're looking for?
Well, that's a pretty wide range, I would say. Again, kind of related to the treatment. So there is an area of the website that is separately organized as treatment by concern. And we felt like that was a better way for patients to come in and say, this is really what's bothering me. And then allow us to sort of say, well, these are the kind of different treatment modalities that you might consider. The other thing I would add to that is that consults are free. I advocate for that very strongly, and we're not unique in that regard. There are other med spas that will do it that way, but the information is so valuable, and good information from the provider who might be doing the procedure is very valuable, as opposed to trying to Google some things. But we encourage anybody to come in and have a chat with us. We accept walk-ins, so really any concern, if something is bothering you, whether it's, and because we do also dip into the wellness side as well, it really could be anything about how you're feeling. If you want to come in and talk, we're happy to have that conversation.
I think that was one of the things that I took away from my visit was, number one, there's people walking by all the time. It's very easy to pop in. So if you're at Fenton and you just want to go check it out, go stop by. The staff is so friendly. They're so accessible. And I think you'll really like what you see. And I do think it's so valuable to people who are just out and about to be able to pop in and just ask a few questions and actually talk to a human being instead of trying to do all the research yourself, right?
Yeah.
So other than Fenton, where can people find you guys online?
So we're at vegavitality.com, and that's the main landing page. You'll find our locations. All the treatments are organized there. We also have a pretty active presence on Instagram and Facebook because that's a lot of the way that people pick up their information. And it is a good way for us to communicate either new treatments that we have or promos going on. We are encouraging people to come in since we're relatively new. This Fenton location has been open for 5 months this week, actually.
Wow, congratulations.
Thank you. And so we're still giving 15% off for new patients, whole invoice, and intermittently running some other specials, just trying to get ourselves introduced to the neighborhood. But yeah, absolutely swing by. Now that we're excited for spring and better weather, we actually have a table we put out front just to invite people to come, sit at a chair and chat about whatever's on their mind.
Yeah.
And that's been good.
I think that's amazing. Well, thank you so much. This has been such a good conversation. And I'm so excited for those of you listening and watching to learn all about this because, wellness is a passion of mine, and so is maintenance. So are maintenance treatments for all my wrinkles since I've turned 50, and I'm trying to keep all those things at bay. So if you're in Fenton, definitely check it out. And I want to say thank you so much for tuning in to today's Best of Raleigh. We are on a mission to share the best people, places, and businesses that you need to know in this market when you're moving here or moving around in this area, and Vega Vitality is one of them. So if you're in Fenton, stop by, and we'll see you on the next Best of Raleigh. We drop a new episode every Friday on YouTube, Spotify, and Apple, and we'll see you there.
Thank you.